Every 19 minutes from a prescription overdose in the United States. Now, the FDA is cracking down by putting new restrictions on some of the most commonly prescribed painkillers on the market. KOMU-8's Andy Lowenstein looks into the latest proposal to battle misuse and abuse.
After a decade-long debate, the FDA wants tighter controls on how doctors prescribe common painkillers. The agency is proposing to reclassify several drugs that contain hydrocodone, including Vicodin. This, as prescription drug abuse has reached an all-time high in the U.S.
An anonymous source who battled a drug addiction for over 3 years says if it becomes harder to get a prescription from doctors, people may look to other ways of getting it, such as on the internet, the black market, or on the streets.
Under the proposed rules, physicians would only give out 90-day supplies at a time instead of the now 180 days. Patients could not get a refill without first visiting their doctor, and patients would need a written prescription rather than having a doctor call it in.
I have to drive 2 hours back to Kansas City and then back here every month for my prescriptions, which is a hassle, and it's just more work for the doctors and the pharmacy.
Pharmacist Bill Morrissey says these changes may cause a lot of patient outcry.
Just in our clientele, we have many individuals who are homebound, whether that's someone who has been in a car accident and has mobility issues, or an elderly person who just doesn't drive anymore, that sort of thing. We have a large number of those type clients, and for them to have to go to the physician every month to obtain that prescription rather than being able to have it called in, I think will be a major inconvenience for them.
Hydrocodone is the most prescribed drug in the country, and new rules would make sure it is used appropriately. Along with changing how doctors prescribe drugs, there will also be new storage and record-keeping rules for pharmacists and doctors. Some healthcare professionals who currently have the ability to prescribe drugs containing hydrocodone may no longer be able to do so. Missouri is currently the only state that doesn't have a prescription drug monitoring program. This program would give doctors and pharmacists access to a database of clientele prescription history.
I think that program would be beneficial. In the world that we live in, we also live with a little bit of skepticism, which is unfortunate for the honest patient.
Andy Lowenstein, KOMU-8 News, Columbia.
The FDA's proposal will be submitted to the Department of Health and Human Services by early December, but the DEA has final decision on whether to reclassify the drugs.